Well, we're continuing with our discussions of the various diseases and ailments that we all hopefully are striving to avoid through living a proper lifestyle, having sound nutrition, good exercise, proper surveillance from a qualified physician to look for evidence of early onset and early detection of any diseases that might bother us. And I think one disease that probably everybody is in fear of, one that I've witnessed in great quantities in experience as an ER physician for over a quarter century, is dementia. Now, I don't know that I think most lay people can give a pretty decent definition of dementia, but I think there's a lot of misunderstanding. I think there's a lot of people that use the term Alzheimer's and dementia synonymously, and they're really not the same. Really, no dementia is all one or all the other. I'm going to talk about the different driving mechanisms of dementia so you at least understand that. And, briefly talk about what dementia is, which really at the basis, it's the inability to form new memories. One of the things you'll see in a demented person is a lot of them can tell you about their childhood, and those are the last things to go, but they can't remember anything recent onset. This is a person that can't remember what they ate for breakfast and can't remember what movie they watched last night. Eventually, they will ability to recognize love. It's obviously a very, very devastating diagnosis to occur in yourself or a loved one, life-altering. Eventually, people need 24-hour care, and it's something that we all should avoid for our own personal well-being and for the health of our loved ones, particularly our offspring who are stuck dealing with us in the event that we travel down this pathway. Like all things, lifestyle has a significant component in terms of preventing its development, and genetics has a significant component in causation. I happen to have one of the genes that's nefarious for causing Alzheimer's type dementia. It's one copy of the ApoE4 gene. One of the proteins on my cholesterol is associated with 4 times greater risk of Alzheimer's dementia. I'll share my cognitive test with you. I'm pretty confident I haven't started slipping yet, so I'm either doing something right or I had good genes there. It's not a one gene thing. This is a very polygenic sort of issue, meaning there's lots of genes that probably help determine how fast our cognitive function declines. But there's many lifestyle factors, and I'm certainly going to spend a lot in the how section on how to preserve your cognitive health. Okay, so dementia. We'll start with Alzheimer's. Alzheimer's is inflammatory dementia. The hallmark of Alzheimer's type dementia is the development of protein replacing the normal brain tissue. The name of that protein is amyloid. We do have testing strategies for actually measuring the amount of amyloid in your brain. And so we can actually demonstrate if you're starting to develop Alzheimer's at the level of MRI imaging with special contrast that actually shows the protein forming, not just screening you for cognitive decline. We know that inflammation is at least in some way tied to the increased production of this protein amyloid in the brain along with genetic factors. And we know that there are certain behaviors and supplementation and strategies that reduce the risk. One thing that we do not have is medications. We are striving in medicine to discover a medication that you can take that will substantially alter risk of Alzheimer's type dementia, and I'm going to have to say we haven't discovered that yet. The other form of dementia, which is probably more common, like I said, most of the time there's some combination of the two going on, and you're mostly Alzheimer's or you're mostly vascular. Now, vascular dementia is probably the more prominent type of dementia. And it's very simply tiny strokes are occurring as we age in our brain tissue. We talked about macro and microvascular disease briefly when we were in the cardiovascular section. And when your small blood vessels are narrowing and possibly even these tiny arterioles are rupturing and thrombosing, little pieces of brain are dying off all the time. And as we age, this is happening in our brain. Little pieces of other organs are dying also. That's why we generally see a decline in our organ function as we age. Well, The amount of tissue lost on any given day is not enough that you think grandpa's lost it. But after 5 years of cumulative small, tiny strokes in the brain, it becomes apparent that you realize grandpa's not as sharp as he once was. This is the concept of vascular dementia. Now, between those two driving forces, most dementia is defined. Now, look, there are other ways to get demented. Alcohol is a great one, okay? We're going to spend time talking about what to drink and the how, and I will tell you that the scientific evidence unfortunately shows that there is a linear relationship between alcohol and cognitive decline. That being said, it's dose dependent. The more you drink, the less intelligent you will become. So, not telling you I'm a teetotaler, but I'm going to tell you the truth when it comes to lifestyle things. And we will cross the bridge of all the different things you can eat or drink, health or harm, and hopefully that'll help you compile things. I hope that was enough of a kind of quick review of dementia. Like I said, we'll dig deep in prevention, but that hopefully will help you to understand that all dementia is not Alzheimer's. The processes that damage our blood vessels probably drive more vascular dementia, though inflammation's in there, as you will see when we get to this section where we talk about the 3 main driving forces for all chronic disease. We'll cover it all. Stick with me. Appreciate you hanging out. And don't forget, the more you learn, the more you can expect success.